Welcome back. In studio we have Dr. Carey O'Rielly, and we're discussing TMJ, the jaw joint disorder that can cause constant pain throughout your body. All right, Doc, before we went to break, we were talking about basically healthy gums, how to get your gums, and staying away from surgery, how to rehab your gums with no pain and make sure you have a healthy mouth. What I really want to talk to you about today is TMJ or TMD. There's a little confusion. What is TMJ?
TMJ is the temporal-mandibular joint. It's actually your jaw joint. It's right in front of your ear.
Okay, so everybody has TMJ.
That's right.
Okay.
TMD is the condition that results from stress that creates pain in this area, localized around your joint, or throughout, could be throughout your whole head and neck area.
Is it because the joint doesn't line up properly?
That's one cause.
Okay. What can cause it? Maybe a car accident cause it, a little whiplash?
That could really exacerbate it,
Maybe
make it worse, more painful.
Bumping your joint, bumping your chin, bumping your thing?
Yeah.
Your teeth not lining up?
As light as that. It's an imbalance and dysfunction of your joint, or it could be the cartilage in there is damaged or not working right.
All right. Now, when I first started reading about TMJ, I thought everybody was a little crazy because I was trying to figure out how my jaw joint could cause my shoulder to hurt. So explain to me and everybody else watching exactly what it is that happens, because I always thought your nerves went right down the back of your neck and then out into your body, and you're telling me that that's not necessarily true.
Well, the reality is everything's connected, even in the nervous system. Pain that's created locally in one area can travel to a different area and can cause pain there or soreness. And that's very common in TMD, joint pain. We find that all the time.
I have an illustration I'm going to show real quick right here that shows, and when I found this, it scared me, all the nerves that come down and go through that joint. So if that joint, as everybody can see now, you can see all the nerves, if that joint is misaligned, what happens to those nerves that go through it?
Those nerves can be pinched or they could be inflamed from the condition. That's what creates the pain.
Okay, now if the nerve is pinched in the jaw joint,
yes,
and obviously, and the pain is in your shoulder, normally what's happening, we talked about a little bit about pain management. We talked about the standard in pain management now is to numb that nerve so that you don't feel the pain anymore. And you were kind of the opposite, that it's more important to fix that pain. How hard is it to basically take care of TMJ and to see if it's causing the pain? How hard is it to find out if your jaw is out of line? Do you have to have surgery? Tell me a little about what's involved if you can quickly.
It's not hard at all. Rarely is surgery required or aggressive treatment even. The whole idea in TMD is to get the patient out of pain. And if the patient is on pain meds, that'll dull the pain, it won't solve the problem. We need to solve the problem, find out what's causing it, and treat that.
So if people have had pain for a long time, a consistent pain, they've taken aspirin before, they've gone and saw a doctor, are you telling me that it could technically be as simple as just getting their jaw aligned right?
In a lot of cases, that's absolutely true.
How do you do it? I come in, and let's say I have a very minor case. What's required? Do I have to wear a big brace? Do I have to, what do you do to realign the jaw?
The first thing we do is look at your bite. What's going on with the bite? Is there imbalances, for instance? If there's imbalances, those need to be corrected, and that oftentimes helps the situation.
If your bite's off, it's kind of like, I likened it to your door not closing right, if it hits the wall. So if your bite's off and it's doing that, that joint, every time you close your mouth, is feeling stress because the teeth aren't closing properly?
The bite is a finely tuned instrument, and it needs to work as such. So oftentimes if we find one or two, and there's a way of doing that that we use in my office, of identifying those high spots and those interferences in your bite.
And so it could be very simple to fix.
It could be very simple, adjusting one or two teeth.
Over time, my teeth, and I see people's teeth that wear down. All right, you see they get worn down over time. Can those teeth wearing down create that difference in your bite?
That can, yes.
Maybe you've not had any traumatic event you remember. Maybe nothing's hit your chin. Maybe you don't know anything you have, but you're still having that kind of pain. Can it just be a natural function of your teeth wearing down?
Yes, it can. As your teeth wear, your bite changes, and the relationship of your jaw changes. If you feel in front of your ear, and open and close, you can actually feel your joint move in your joint. And this is one of the most complicated joints in our entire body, and it's one of the most important ones.
Most joints only have two bones. You have the socket and the ball, and they rotate, right?
Yes.
This joint, you're telling me, has multiple little bones in there that all have to line up in a certain way.
Well, it has a bone. It has the ball part. That's a condyle that you feel moving when you open and close. And by the way, you can actually hear sometimes the clicking or popping or grinding of the joint.
Is that a
in the
pretty
socket.
good indication if you hear clicking or popping when you open and close your mouth that you probably got something wrong?
It is.
Okay, so the joint has got the ball. What else is involved in that? Because I know there's a bunch of little...
It's got a cartilage between the ball and the bottom of your skull, actually. That's where it fits, actually in your skull. So if that's not working correctly, then there could be pain created from that and stress. It's a product of stress from your bite to your joint, to the muscles around the joint in your head and neck, and even in the structure of your head and neck, the bones in your skull.
Okay. It sounds, it sounds very complicated. You're saying it's pretty simple. How soon, in the most easy to fix case, how soon can I start to experience pain relief if I get my jaw? Okay, is it take a month, a week, a year, a day? Can it be instantaneous? It
can be the first visit. It depends on the patient in a lot of cases. If we start working with someone in the first visit, a lot of times that helps. We can relieve some of the stress from the bite that needs to be addressed. And
you were telling me, and I keep, because there's so much information, you were telling me that it's just sometimes a little splint that they wear. They put in their mouth, maybe whenever they're feeling pain, it's just a small little apparatus that they put in that can actually start to help relieve the pain.
Yes, we can place a splint. That would come next. After the teeth are adjusted, we do the splint. We make a splint for the patient in a lot of cases, and that repositions the joint, takes a lot of the stress off the joint, so it doesn't hurt as much. And we can work through that process.
Can you
with the
see
patient.
that, or is it possible that people would never even know somebody had it in there?
It's clear. It's actually clear plastic.
So I have it in the back of my mouth, I'm talking to you, would never know I had it.
You can speak with it, you can talk with it,
Okay.
you can function with it, you can eat with it even if you need to.
So it's pretty simple.
Doesn't need to be a deterrent at all.
You're telling me if I'm in constant pain, if I have headaches, if I have joint pain, if I have things that continue to happen to me that are painful, that I've got no reasonable explanation for right now, I should go out and get checked for TMJ.
If you have head and neck pain,
Yeah.
it could be headaches, could
All
be
right.
in your temples,
I'm
your
going to put you on
forehead.
the spot. Okay, we're out of time, but I'm going to put you on the
Okay.
spot. I know on your websites, because I've gone to them, you have a lot of information on TMJ, you have a lot of information on healthy gums, on metal-free dentistry. You have all that information for people that don't maybe have web access, for people maybe aren't big into reading and doing all that. Can they call you, and will you take the time to explain to them everything else they would like to know that we weren't able to cover today?
That's one of the things I do in my practice. I spend a lot of time with my patients.
Do you enjoy what you do?
I do enjoy what I do.
Do you get a big emotional reward helping people?
I do.
Dr. O'Rielly, I want to thank you for coming on the show today. You've been more than informative, and I hope that everybody takes to heart the good, healthy advice you've given us.
Thank you.
You've been watching Medical News Network. For more information on this subject or any other, please visit our website at medicalnewsnetwork.info. For now, I wish you good health.